Welcome to the doctors. Today we're taking a very close look at a brand new procedure that's making headlines. Why? Because it promises to zap away one of every woman's biggest fears, wrinkles. We've all heard about Botox, but now there's a new procedure. It's called GFX. It promises longer lasting results. But is it too good to be true? Drew, I got to tell you, I'm not so sure about this because it deadens nerves.
GFX, glabellar furrow relaxation. Big words. We like to call it no-tox versus Botox, next generation Botox. And it is different. No injections, no toxins, but it is more invasive. We're actually using a probe that we actually put into the nerve of the muscle around a wrinkle and actually cook it a little bit.
Just a little bit?
That's controversial.
I don't know if I need that.
That's controversial. But we have a patient, Evelyn, a 53-year-old, who was treated with this a week ago. We have a before picture. Okay, that's a pretty good furrow in that area. And she's in back right now in the procedure room with her doctor, and we're going to show the results of this procedure.
And is this my furrow right there?
Well, you've got the furrow, but you've got this going on too.
You need a lot of work, Travis.
We're going to have to talk later, Travis.
Let's face it, none of us like to see the signs of aging on our faces. A new wrinkle here, a few lines there. It isn't always pretty. What if someone told you there was a state-of-the-art new procedure that could zap your wrinkles away? Would you try it? 53-year-old Evelyn did.
Here, the idea is to place a physical injury to the nerve so that the muscle is not able to contract. You're damaging the nerve so that it stops sending signals to the muscle.
I don't like that. I could see that I'm starting to show my age, getting old. Not good.
Botox is not appealing to me at all. It's a toxin. 10, 20 years from now, what could it do to me?
There's a portion of patients that for one reason or another are opposed to the idea of Botox.
I was looking through a magazine and I saw about the procedure GFX, and it seemed kind of interesting and simple, and that it would last a little bit longer.
The results can last up to a year.
This procedure doesn't really seem dangerous to me.
It's not a quick thing like Botox. It takes 3 minutes. GFX takes 45 minutes. It's got a little bit of downtime. How do you feel? You ready?
I'm ready.
Great. So the first thing we're going to do is use the nerve stimulator. Map out your nerve. We're actually stimulating the nerve that you want to damage right then and there. If you can see that twitching there, the nerve is running through here to basically innervate this muscle. We're going to go put a little bit of numbing injections, and we're just going to make a little nick in here. Now remember, she's numb here, okay? So here we go. And whenever I'm pressing that button, I'm stimulating the nerve. Here comes the little zappy part, okay? I know it hurts a little bit, and it's going to go down soon. Take deep breaths. Did you see that muscle contraction? So the nerve just got a bolt of radio frequency, and that's how it contracts. Turn on one side. We're going to just repeat this on basically on all those sides. Whoa. Okay, sorry. Almost done.
It hurts. It gives you like a slightly burning sensation. It's a little bit uncomfortable. Beauty doesn't come without pain.
Evelyn had this done a week ago by Dr. Cameron Rokhsar, one of only a handful of doctors doing this procedure. They're both with us today. Before we start, let's look at Evelyn's before picture. Now let's look at her face now and compare the two. There's no doubt that the lines are gone, but I have to tell you, the procedure looked awfully invasive, and I'm thinking, why would you want to go do this? Everyone in the audience is cringing. They're hearing the thing go zap, and they're like, oh, no, not me. No way.
It is painful. No doubt about it. It is painful. But the outcome is very good.
Well, the results are pretty impressive. Yes. But this really is a clinical trial, isn't it? You're one of, I know you're one of a few that are doing this.
Yes, I mean, the device right now is FDA approved for ablation of nerves. But what's happening is that the procedure is going to be marketed as something called relaxed expressions. Mm-hmm. And it's currently under clinical trials for official cosmetic approval. It is FDA approved, just like Botox was for years, but we were using it off-label. It's the same way. So once it gets cosmetic approval by the FDA, I think that you're going to hear more about it.
Significantly more expensive.
Well, it's significantly more expensive in a sense that, you know, an average Botox injection costs, what, $500?
Correct.
You know, we charge something like $2,000 for this procedure, but you can imagine for Botox, you have to go back 6-7 times for it to last 2 years.
But Dr. Rokhsar, isn't this borrowed from what we use to shock the heart when it's in cardiac arrest?
It's from electrophysiology, actually. You're absolutely right. So, you know, in electrophysiology of the heart, those doctors, you know, when you have abnormal heart cells that beat abnormally, that whole science is we go and we use radiofrequency, pinpoint radiofrequency ablation to get those abnormally beating cells. And this is the same principle. We're basically using radiofrequency to put a zone of injury to the nerves that we don't want to function.
I really have issues with doing this in the face around the nerves of the face, not only the nerves that move the muscles, but the sensory nerves and the muscles themselves. Because if you know, we can get into these things where the muscles twitch, we can have the muscles, you know, moving in an abnormal way, just like with a facial palsy. If you injure it, it comes back, and things may not move.
I think the moral of the story here seems to be that this is a new procedure.
Correct.
It scares some doctors, including Dr. Orton. It's a little bit frightening to me. I will say this, I don't know if you can see up here, but I'm looking at these two guys. I don't see a wrinkle on their faces. That's just me. Doctor.
We know all the right tricks, right?
Coming up, if you're looking for an alternative to the GFX procedure, we'll tell you everything you need to know about the gold standard for getting rid of wrinkles. It's Botox. That's next.